On the second day of the transition to the new Social Health Insurance Fund, and the scheme has run into serious headwinds, key stakeholders remain non-committal on its implementation. Hospitals under faith-based organizations and the Rural and Urban Private Hospitals Association of Kenya maintain their members will not sign the contracts which they term as flawed. They say the contracts are designed to lock them out of service delivery and disenfranchise Kenyans seeking healthcare services. They take issue with the government for failure to assure them that money is owed by the now defunct NHIF will be paid under the new system, expressing fear that records of what is owed may be destroyed or lost in the transition.
The reason we worry about a transition with claims pending is because also there is a system change. And we've had experience in the past when where a system changes and some of the claims that were on process kind of become lost in the system. And it takes time before you can have them reconstructed, audited, verified. We've been following up, individual hospitals collectively as FBOs, and we've been following up, individual hospitals collectively as FBOs, and as of now, we feel there has been, it's in the about 6 billion that is still not cleared.
NHIF owes healthcare providers, government, faith-based and private, total about 30 billion. For us in the private sector, what we are owed is somewhere around 15 billion. We have been categorical that there should have been a reconciliation of pending bills so that each and every hospital can sign off with NHIF before NHIF closes. What we are concerned as providers is that somebody could switch off a switch one day and those claims become lost.
The stakeholders maintain that even though they engaged the government in the policy formulation stage where they gave recommendations and voiced reservations regarding the contentious issues, the authority disregarded their opinions. Dr. Samuel Mwenda, who is the chair of the Kenya Health-Based Health Services Consortium, says the referral system is a deliberate attempt to cripple their operations.
Hospitals have been providing outpatient services through capitation for populations that chose these hospitals. The new arrangement, outpatient services will be provided in primary health care facilities, level 2 and 3, which means not at hospitals. Hospitals will only receive referrals from that level, and they'll be paid a fee for service. The other challenge is, of course, the system is not proper operational for us to do verification.
Is saying that that level 5 hospital cannot provide direct outpatient care to those 24,000 Kenyans who have been using that hospital. Kenyans might not know this, but if you walk to that hospital, it is illegal for that hospital to provide you care.
The two umbrella bodies which constitute a sizable portion of the healthcare service providers in the country say they will treat patients on cash basis, and there is currently no contract in place. They accuse the government of mischief in crafting the SHA contracts, terming the reduced benefits package a slap in the face for many Kenyans who, despite the increased contributions, will be forced to make out-of-pocket payments. They maintain their members will not sign the contracts until the Social Health Authority amends the offending clauses. As the government and key players in the sector engage in a battle of wills, the delivery of healthcare services has been disrupted by the standoff, with opinion divided on whether the transition was rushed or adequate preparation was made. Mary Mwoki, Citizen TV.